lucky enough on this panel that we have both the agency side represented as well as the endemic publisher. So we have Francis and Ray from the agency side, and then we have Tom and Damon from the publisher side. So really going to keep this moving in terms of getting different perspectives in this topic that's really been a highlight. I think even this morning, when Chris started the morning all about fragmentation, this is a lot about fragmentation in terms of the opportunities and the decisions that as agencies and pharma companies, when you're making decisions of where your media is, the fragmentation in the marketplace is just endless. So we're going to go ahead and jump in and just kind of set the stage in terms of where we are on this topic and hear from everyone in terms of what have you seen over the last 2 to 3 years in the endemic and programmatic space coming together? And also, what is the role of endemic from your point of view? So Francis, we'll go ahead and kick it over to you.
Sure. So I mean, at Kinesso, we do a programmatic like publisher RFI every year, and it's funny because I was looking at the last couple examples of it right before this panel and getting a sense of the partners we were reaching out to in 2021 compared to where we are now. And you know, Damon, I would say that Veradigm was not someone we were even really reaching out to from a programmatic perspective up until the last year or two. And there are so many more partners that are now leaning into the programmatic space from the endemic side, which is exciting. It's a lot of partners that are at least like telling us what's on their roadmap, challenging us with how we can help them get more of their inventory available programmatically. And you know, I think we've all probably heard plenty of cases of people talking about the importance of finding physicians in blue jeans moments and audience first approaches, which are still obviously extremely valuable. But I think this shows that endemic is always going to have a place in that journey. Intent is always important, and kind of reaching those physicians when they're really leaned in.
Yeah, so at Everyday Health Group, we obviously have a couple different audiences who we are providing content for. We have our consumer group with Everyday Health. We have MedPage Today. We're reaching our HCPs, and then we have Baby Center and What to Expect. We're reaching our parenting and pregnancy group. And over the past couple of years, there's been a real convergence of what we're doing and what we've historically done as an industry, you know, on the endemic side, and looking at how we can mold the direct standpoint that we have, along with the programmatic influx, I'd say, that's going through the industry. So it's been a lot of education. I mean, that's been like the primary thing, you know. Right. When people historically heard programmatic, they were thinking of remnant inventory. They weren't thinking about, you know, using the programmatic play as a vehicle to deliver the campaigns. And so, you know, it's kind of like pharma's always, you know, late to the game a little bit. I think the endemic side has been very late to grasping that concept. And so, but I think we're getting there on the consumer side. I think it's a lot easier. You know, we're working with Kinesso and other agencies that are, you know, just buying directly programmatically. And I think that's really opened up a lot of doors and a lot of more understanding. And that's something that we're going to continue to push because we know that they both need to live together. And not only that, they're going to thrive together. So I think that's, I think that's where we're heading in the future.
Great.
So I think the big change from even a year ago is that I wouldn't be sitting in this chair a year ago because the demand wouldn't be there to have an ambassador of point of care, an ambassador of EHR, talk to a programmatic buying community. Has been a managed service business. You mentioned it's highly fragmented. Yeah. It's the data, the harmonization of data from one vendor publisher to the next is different. It's expensive. It's also a different ecosystem because it is a clinical encounter, whether it's at the pharmacy or telehealth or in an actual clinic itself. So it's always been a managed service business. That's changing, and the way I know that is almost all at once, the demand came to us and said, look, as programmatic buyers, we're really good at the top of the funnel and mid-funnel. We're really good at building awareness at scale and optimizing and working with data. But then there's a gap because the patient and the physician start to come to a point of communion in a clinic or a pharmacy or whatever, and we're not there. So all of the investment, all of the strategy at the top of that funnel, the mid-funnel, leads to leakage if you're not there at the bottom, where there's so much disintermediation, where there's so much clinical decisioning going on, there's so much prescribing decisioning going on. And so it was not a connected journey, and I think people started to wake up and recognize that despite the challenges of that fragmentation, there's still a desire to be able to do everything within one system for a connected journey. And so We've responded to that through our partnership with Deep Intent, and the demand has continued to grow. Now, there's still frustration with scale. Scale will come, and I would say one thing. So my anecdotal data tells me that about 1%, maybe 2% of programmatic spend is going into point of care. Where does 100% of conversion come from? Point of care. So there's a huge dissonance there, but everyone is starting to get skin in the game, which is why a year ago I would not have been here, but today I am.
Awesome. Great.
Yeah, I think, I agree with everything that everybody has said. I think the thing for me and us at Click is the fact that what Deep Intent really brought to the marketplace is be able to reach physicians in non-endemic moments, look at them as consumers. And obviously, data and programmatic has brought that ability to the patient market as well. And I think what has gotten lost in the mix over the years is the fact that endemic is a data signal, right? Contextual adjacency is a data signal. Engaging in an EHR is a data signal, right? And as you said, it's kind of last mile. It's the pull through. So, what's really appealing to me and what I'm excited about is that marrying of sort of your ability to broadly target in non-endemic moments at the top of the funnel, but really be able to source and identify data signals within your media to be able to tighten the aperture of delivery and say, there's something happening in this moment, right? This is an in-play possibility of a patient and physician talking to one another. How do I triangulate that moment? How do I deliver a message that's a reminder but also drives pull-through? And I think when we think about data connectivity and omnichannel, that's a big part of the equation for us. And all data is in the past. It's really about the speed at which we can recognize that data signal and act on it and deliver relevancy in that moment.
Great. Excellent. Shifting gears a little bit, just to talk about in the endemic space for the publishers here, in terms of what are you doing back at the ranch? As it's in a world of direct IO is still the main course of action in terms of the transactions of that. What are some of the things that you're doing? We talked a lot about education. We talked a lot about innovation, other things that you can do to make programmatic easier to transact with, easier for agencies. Tom, I know we're doing things in the patient space, but if you want to talk a little bit about that in terms of at Everyday Health Group, what's happening?
Yeah, thank you. Well, first of all, it's my true belief endemic is not dead. I know that sometimes it's a prevailing thought, but for all the reasons Ray just said, we're really focused on continuing to build out great content because great content will give those strong signals. And we think that's going to only increase, how you're delivering the advertising to your target, whether it be HCPs or consumers. And, about 2 years ago, I really, actually, Ray, you might not remember this, but we were in a meeting in your former life, and something really clicked with me when you were talking about the vehicle for delivery and signals, and I actually created a product called Salus Signals because, that's really what we want to do. We want to provide information and the ability to reach the audiences that the advertisers are trying to reach. And so we're really focused on the consumer side with building out that strong content, but also curating that content, making programmatic buys successful. We want everyone to win. We're not looking to maybe have a view of the past where we used to say, oh no, we're direct IO, programmatic is just from an unbiddable format. No, we want to look at it now and partner. I think that's something that we need to focus on too, is the partnerships, and not just be an afterthought, not just say, all right, we'll do a PMP deal with you, and here's your price, and set it and forget it type thing. I've actually structured a team that is now focused on having those relationships with the agencies so that we could help, we can increase the likelihood that the campaigns are going to be successful and that everyone's going to win in that regard. So, and on the HCP front, I think that's one of the challenges where you have a limited population who you're going after, and you have certain MPIs or targets that you're trying to address with the creative. And it's taken a while for that group to really come to the notion that, okay, this is not going to hurt my business, it is going to help my business. And that's transformational, and it's slow, we're just getting there, but it's a focus of our company, and that's something that we really expect to continue to grow over the next couple of years. And that's why our partnership with Deep Intent is so important, because we feel there's a lot of opportunity there.
Yeah, no, certainly once the announcement came out, there is definitely the appetite for it. People want to learn more and all of that. I think we're always, cautious of the scale and all those things, but I totally agree. Endemic is not dead by any means.
No.
And, it's striking that balance is a lot of things that we talked about over just in terms of our prep calls and that too. So
Exactly.
I think, it's, again, striking that balance. And then I think, Damon, when you say you're really the endemic of endemic in terms of really being
Long
in
live
that,
endemic.
of being in that lower funnel HCP space in terms of at Veradigm and that in terms of what you're doing.
Well, so I don't know if any of you were at PACMA last week. Was anybody at PACMA? Now I know Sarah, I know you were at PACMA, but this is very telling. It's a different crowd that's not accustomed to a point-of-care marketing association summit with hundreds and hundreds of marketers and maybe 100 companies all talking about endemic point of care. They're going to struggle. We are absolutely in the early adopter stage of a traditional point-of-care publisher ecosystem stepping into programmatic. It's scary, and I can tell you because I've done it. It's scary because you're losing the control point on your customer. You're losing the ability to have a direct conversation and consultatively differentiate yourself from everybody else. It's scary because you feel like you might be commoditizing yourself when you're bundling your NP eyeballs with everybody else when what you do is strategically and tactically different than a lot of mid-funnel and upper funnel strategies. So it's scary and confrontational, but at the end of the day, our job is to be where the demand is and to allow marketers to buy the way that they want to buy. And so we're at this inflection point right now. We've stepped into it. And what I'm seeing personally is a lot of hybridization. I'm seeing a lot of hybridization where there was a programmatic component to the partners that we work with, but there are certain use cases where managed service still needs to be the way that you operate. Whether the creative assets are different, the triggering is different, the types of data that you're looking for signals from or measuring what good looks like is different. And so we're kind of in this in-between stage where we have that hybridization. If I were to take out the crystal ball, I would say over time we're going to move in a programmatic direction because of all the reasons why you're in the room today. The efficiency, the optimization, the real-time data feedback, all of those are very, very good reasons for point of care, EHR, and endemic to start to support that community. All ships will rise. And then we have to differentiate other ways. That's the way the world works. So that's what we've seen so far. The early adopters are there today. I think the mainstream is going to follow within the next 12 to 18 months.
Great. And any other things, like just, we talked even a lot about educating internally with your sales force and your product people, in terms of just getting them to also start partnering with DSPs and things like that. I know, Tom, your team is working very closely with us on that front. Yeah. Just, getting all the different teams in the organization to get on board has got to be a big lift as well.
It is. It's a big lift, but it's an important lift, and it's something we are very focused on. And when you take traditional sellers who have only known selling from a direct basis, they look at programmatic sometimes as the enemy. That's going to take away money from my pocket. And then again, it's the education of showing them it doesn't have to be that way. It doesn't have to be, it's an and, it's not an or. And I think if we could partner more also with companies like Veradigm and do things that are, we're running on our platform. We're also running an EHR. We're running extensions. And I think that's really going to open up the receptiveness that comes with it. And I think that's where we're trying to go. But it's definitely a challenge. I'm not going to sit here and be like, it's an easy type thing. It's a challenge, but it's an important one. And I'm the biggest advocate for doing this because I think everyone has to address the audiences the way that our agency partners are trying to reach them, and we also have to provide back those signals and that information that's going to help them do better in reaching their audiences. I mean, at the end of the day, we're all trying to reach the right HCP, reach the right patient, and we all need to work together to do that. So that's a quest we're on right now.
Let's shift gears a little bit, and I think from the agency side, Ray, you talked a lot about the decision process in terms of what the pharma companies expect from media buys, and not only just from the media delivery, but on the back end in terms of, especially on the HCP side, as we live in an omni-channel world, MBE, MBA, and all of the requirements that are necessary in terms of from an ad tech platform or from an endemic partner, when you're making these decisions, what are some of the things that your team is going through from a planning side? And we talked about even planning, what's planning now, and how you rely on endemic partners versus programmatic. We had some really healthy conversation around that.
Yeah, I think it's from two levels. I think first is when you think about just the sheer number of partners that are fighting for a dollar that hasn't really shifted dramatically, those two things are sort of getting wider and wider, meaning there's more partners than dollars. So as an agency, when we think about the RFP process, it's who do we invite into the RFP and how many can we manage, based on the time we have allotted and the dollars we have. So that means that certain partners that might be a good fit are left off the plan because we just don't have the bandwidth or time to sort of vet a ton of partners because of the way we have to buy that media. The second piece is the data, and I think one of the things that, Tom, you and I talked about this years ago, but what our clients have really been fighting for is that data, that exposure data. That's so very important to them. And clients have built infrastructure and hired talent to sort of collect and analyze that data. Agencies are trying to meet them to do the same thing. And not to throw shade on the partners, but like what we struggle with as agencies is partners meeting that need of hiring tech talent, of understanding the value, speed, and structure of that data that we need to pass on to our clients. And as an agency, I've been in many conversations where we're getting our ass kicked from a client who's not happy with the data, the lag, the structure, and we're taking one for the team. And the reality is like we have a data partner, it's not really helping us. And the result of that is like we're just not going to work with that partner anymore because they just make it too hard to work with them. So in a nutshell, from an agency perspective, I think what we're all yearning for is like make it easier to work with you, make it easier to get on the plan, find a way to make that data pass back super easy for us. And I think when you think about, Chris talked about fragmentation, it's a growing problem. In fragmentation, there's so many places to go from an endemic and non-endemic place to reach partners. For us, at the end of the day, we're going to probably make decisions on what's the easiest path to reaching them, what is going to be the sort of lightest lift for us as an agency while still driving the right outcomes. And I think that's a shame for the endemic community that I believe in so wholeheartedly. I think it's so very important, but ultimately we're going to have to make business decisions based on sort of the ease of working with them.
It's as a follow-on to that. So the bar gets raised for guys like us every year with the agencies to pass more data, to pass it consistently in a format that they're used to getting it from all the other partners, to push the boundaries appropriately and compliantly around privacy and data rights and what we can and cannot do. It's just a cost of business and something that we learn to deal with. Programmatically, that whole conversation simplifies for us greatly because we pass the NPI information back to deep intent, and all that harmonization, all that optimization gets funneled through their tool. And so it takes a lot of the burden off of us to deliver that physician-level data, that passback. We do it when we work direct because we have to, but then you have an agency partner who's getting it 18 different ways with different data elements here missing and other data elements that they don't know what to do with. And so that harmonization is extremely valuable for everybody involved, all stakeholders. And so that's just one thought when you're talking about that.
No, you're absolutely right. And it's what clients really value. They're all striving towards, this omni-channel approach, this next best engagement, right?
Yeah.
And so much of it hinges on that data. If that data, is wrong, and by the time we get it right, 2 weeks have passed, like that moment's gone, that ship has sailed. So it's really about, how quickly can we get the data, how quickly is the data right, and can we act on that quickly? Yep. It's so very important to get to that sort of, pie in the sky that our clients are trying to get to from a media perspective.
If I could jump in on that too, I'd say that, definitely agree with all those points. I do think that on the agency side, we also have, we have a role to play in that where I think we can do a much better job of to what you two were saying in terms of kind of the direct sellers versus the programmatic sellers, getting everyone on the same page. I think that there are still a lot of silos that exist on the agency side when it comes to the way that we're briefing partners, when it comes to the way that we're vetting partners. I think we've done a pretty good job of that over the past however many years I've been at IPG, but it's never going to be perfect, right? And so I think it's really imperative that we're all thinking about this from a holistic media plan perspective, that we're thinking about this from when we get into planning season, so it's not like you're getting an RFP from a direct team here, an RFP from a programmatic team here. We're kind of doing duplicative work. To your point, Ray, there's a lot of different partners out there, and like the only way we can, vet as many of them as we can is by being more efficient on our side. The other thing that you brought up, Damon, about the fact that none of us were at the point of care summit, I think education and transparency across both sides is such an important piece as well. I'm always reminded of what happened and is still happening with the TV space. I work with a couple people in TV that I always say are some of the smartest people I've ever met, because I understand 20% of what they're saying, and I feel great about that, but it's a different language to me, right? And I think that's what we deal with a lot of Endemic versus what we're doing programmatically. If we can't find a way to close that gap a little bit quicker, then if we were having this conversation next year, you'd be saying that 3% of point of care is going to programmatic instead of something a little bit higher, which is on all of us to make sure that we achieve.
Yeah, we had talked about that gap in the education and the briefing process and all of that, even when we were talking. So, Francis, I'd love to just get your point of view of when we are talking about in the programmatic space, of how you're working with your teams and your clients to talk about that scale and managing scale versus reach and all those things that we talk about as Endemic's moving more over, and how you're using AI to deliver against this, and some of the programmatic tactics in that space.
Sure. So I think it goes back to what I was saying in the beginning about the way that we're always RFIing all of our partners. We're looking at a bunch of different categories, so whether it's just pricing, whether it's reach, proprietary inventory, connections to some of the platforms we're working with, whatever it is. There's never going to be a one-size-fits-all solution to any client. It's campaign by campaign. So again, that's kind of depend on what the briefing process looks like, of how you want to balance scale versus premium inventory, for example, for any given campaign. So I think it's important that we kind of approach it from, again, a case-by-case basis. From an AI perspective, I always caution our clients that I don't think it's something that they should be afraid of. I think it's important that everyone recognizes that we've been tapping into AI since I've been in programmatic. It's the reason, it's kind of the backbone of what all the DSP algorithms look like. It's just getting a lot more sophisticated.
Exactly.
So the rollout of Cortex, just being able to, optimize a little bit more efficiently and quickly to actual KPIs that matter to the clients instead of the front-end metrics of CPCs, CTRs. What's really exciting about that to me is that it just means that we can get a read on performance a lot quicker. We can kind of make decisions a lot quicker than we had in the past, and we have to wait 6 weeks to get any sort of data, a couple months after that to actually plan a shift away from something to something else. And it just creates a lot of opportunities from a test and learn perspective. So that's why a lot of us in programmatic are in programmatic, and it it kind of opens a lot of doors for us that way.
Great. Quick side story, 6 years ago, I was at Initiative, and Francis was my programmatic lead, and he taught me everything I knew back then. So we were actually laughing that we're now on a panel about programmatic and endemic and bringing this all together. So
I wouldn't say everything, but maybe.
Yeah, you got me started, so it was definitely, definitely a flashback now to be talking about this, which is great. And I think the fact that we, even just the fact that we are all up here talking about it shows the progress that we're making, and that it is something, I love that you said, Damon, a year ago you wouldn't even be here talking about it. So the progress is there, the desire is there for the integration to happen. So I think we're just kind of taking those, we're getting there in terms of those steps. But if we were to think about, if we were here 2 years from now, and we were talking about, what would we want to be talking about in terms of the great success stories that we may see of how we could maybe work together in different ways, bring different types of deals together and all data integrations and things like that. Anything that we want to think about of where we could be in the future, even just 2 years from now, just considering all the progress we made in just such a short time. Start with you, Ray.
I think more simply is just in a place where the solutions are meeting the market needs, right? We think about fragmentation. Well, that means that we need to buy in a fragmented way, right? So, is there unbundling of solutions and products that make it easier for us to meet all those fragmented moments? I think, data interoperability and data sharing is, hopefully something of the past where, the sort of desire to shield your data because you want to protect it, and recognize that like the value is for our clients ultimately to drive outcomes. And I think just the ease and sort of creating a more frictionless process for us as agencies is really what we desire. How do we make it easier to buy, target, and drive outcomes for our clients? And I think having more inventory and partners available to us programmatically that is quality inventory and quality moments within the journey of which we're targeting, I think that's our holy grail of what we're trying to get to.
I think in order to service that ask on the supply side, on the publisher side, you're going to start to see some strange bedfellows. So what do I mean by that? I think that as programmatic rises, folks like Veradigm are going to have to work with folks that they may not have ever worked before, like in Everyday Health, to bring the supply side in one place. Because Deep Intent doesn't want to be an SSP. They want to find an SSP that's a one-to-many connection point to bring all that inventory, all that data into one place. And so we're going to have to be adaptive and agile in figuring out ways to deliver that without disintermediating ourselves. And that's going to make us ask ourselves some tough questions about what a partner looks like. So I think that's one, and I'm actually excited to go through that process and take some steps around all of that. I also think education is slow in Endemic because on our side, we've spent years accumulating subject matter expertise to talk about everything from, I could talk to you about a doctor visit, a 12 to 15-minute doctor visit for 2 hours and break it down for you. Passing that knowledge to a rep who passes it to a programmatic rep who has X amount of time to fill out an RFP or talk with you directly about what's in their bag, it gets diluted. It takes a long time for that information to find its way up and to work its way back down. And so I think education needs to accelerate. We're doing that today. And a year from now, we'll be in a much better place with more assimilation, if you will, about what endemic means to your overall MMM. So I think those two things are what I think about when I look down the road.
Yeah, and I really echo the sentiments of both Ray and Damon, and it's the education part, which we've kind of discussed a little bit, but it's also coming up with ways that you can kind of provide the data in a faster way, provide the most accurate data, and that takes a lot of internal changes. It takes staffing in the right areas. So just as we think about just getting people on board with doing things from a programmatic standpoint, and then getting the whole business to kind of shift in terms of, all right, now we know what we need to do overall. We need to build internal teams that are going to help drive this. It can't just be one or two people who were there running things programmatically in the past. It has to be, from a managed service standpoint, it has to be someone who's going to really provide the data, provide fast data, give all the signals that they need. So I think that's important. And then also, one of my big things is making the connection with the patients and the HCPs and coming up with ways to do that programmatically, maybe outside of like the current state, like building products that we could take out to the marketplace that can be delivered programmatically. I think we need to move away a little bit from that only having a direct offering, and deliver things the way clients are going to find that ease of use to reach their target, to get that feedback, to get the measurement. And so I think that's really where we're going to go in the future. And again, communication and partnerships I think are going to be very big ones. Talking to the right person on the agency side about a programmatic opportunity, rather than just getting it thrown over the fence and say, hey, we'll buy this at whatever dollar CPM. Like, let's have a discussion of who are you trying to reach? What kind of data can we give you? Are you doing it from a self-service standpoint? And so just having those discussions and being more open, I think, is where we should be going in the future.
Right. I think even just the signals and that as we're building audiences for our clients, what are the signals that you could put into those audiences? And we work together a lot of, just even those early stages of talking about that, we're moving fast on that front, which is super exciting.
The signals are going to change greatly because of AI, not to branch off. But just within EHR alone, ambient scribing, coding, prior authorization, all of these things are bringing data that you folks have never seen or played with. And it's formally unstructured data that you can't do anything with, and it's going to be structured. You're going to get signals earlier, they're going to be richer, they're going to be more dense, and they're going to be actionable. And so, again, point of care as the ambassador, you're going to see more and more of that start to come into play over the next year as well.
Exactly.
At the risk of being too duplicative, I agree with what everyone said, and I think I would hope that if we're back here in a year from now or 2 years from now, that we keep on seeing more and more new partners up on stage, and I think that one of the things that I feel like I've been talking about ad nauseum the last 6 months or whatever it is just the impact of state privacy laws and what that's going to do to our media mixes in terms of less of a complete reliance on third-party data segments. I think it's a really good opportunity. Like, I view it as more of a chance to diversify a lot of the media plans that we have, test out some new partners, expand into different channels. So it's something that I hope spurs a lot more innovation in that way. And there are more people like you, Damon, popping up that would not have thought to be at a pharma summit before. And it's exciting, it's definitely daunting, but something that we're looking forward to.
Okay, that wraps us up, and we have a couple of minutes for some Q&A. So we do have just a couple of minutes. If anyone wants to open it up while you have these folks here, feel free, and love to take the opportunity. I think what's super exciting is it is inspiring, and this is within our reach. Like, we're making these conversations. It's nothing that's not doable or anything. So it's great to see the progress.
Sure, I'll throw something out there. Ted Sweetser from Purple Lab, something Francis said set me off, which is CTR, metric I cannot stand that never seems to die. I am curious, what you see as like the KPIs or the metrics that matter in endemic publishing in the future, especially as so much of today's conference is talking about optimizations that really don't relate to traditional CPG metrics like someone clicking on something and adding it to a cart, but seeking out a healthcare professional, asking if a medication is right for them and getting prescriptions, which is a substantially more complex metric than what maybe the standard industry evolved towards for digital things initially, and disregards the value of the context of endemic inventory, such as it is.
I think, again, like it does depend client by client, kind of campaign by campaign. I do agree with your overall sort of feelings towards CTR as a metric. And I think what's been exciting for us in the programmatic space, I think, first of all, Ray was talking about this a little bit with, it is important that we understand exactly the type of data that we are getting back from our publishers, that we know what the capabilities are. For the HCP side, like, everything is so reliant on what we're able to tie back from a PLD perspective. And that's kind of always going to be the be-all, end-all from that level. But the reason that it's also exciting to bring so much of the endemic inventory over to programmatic platforms like Deep Intent is that we can optimize actual metrics more so than we ever had before. So it's not relying on what does this site do to kind of bump my CPC up or whatever the case might be, but actual like metrics that they're going to care about in their measurement plans. So yeah, I mean, it's different depending on HCP and DTC. For HCP, it's really more about that PLD, but it's exciting to kind of be able to optimize the actual like patient starts, AQ, stuff like that on the consumer side as well.
I'll just add, I think in order to move away from that, we have to bring in new data points that change that conversation, right? So what was the information that you were adjacent to? Like, help me define that content. Was it upper funnel symptom-based content, or was it lower funnel treatment-based content? Talk to me about the ad experience on the page, which I know some of this is available, but I mean, God, if you've ever, my team's tired of hearing me talk about this, but like, if you've ever tried to make something at home off of a recipe that you found online, and you're going back and forth, and it keeps reloading the page and jumping it back up to the top, and you're trying to close videos, it's the worst experience ever. And I tell my team, if I ever see one of our clients' ads on one of these pages, I'm going to lose my mind. But like, I think we have to. That's the downside of programmatic. It makes it so easy to target, and just because I'm the target doesn't mean it's a great experience for the end user, and it doesn't mean the ad actually resonated based on what else is happening on that page and what the intent of that moment is, and what else everybody else that's trying to reach me in that same moment. So I think to move away from that, we got to get better at telling different stories about what we think is happening in that moment that we serve the ad, the attention that we think we garnered, and sort of the experience that the end user had in that moment.
And I think that's how we try to combat it too sometimes. Like, if we get notifications on low click-through rates, and I sit there and I'm like, well, I was doing this like 10 years ago, and we've evolved so far since then, but I understand it's a leading indicator, but we need to provide those other data points that show, well, here's how the people are engaging on this page, and here's the relevant content, and maybe the creative didn't resonate with a particular audience, but we're showing that the value is there, and obviously we could really show it from a conversion standpoint, but it's something that we need to definitely get the industry to, I'd say, refocus on, because going back the other way, I think is going to be a little bit detrimental to our industry.
Yeah.
Hi, how's it going? I'm Paolo from Clever Programmatic. My question is, do you guys leverage location data, and how granular do you get?
We do, to a certain extent, but I would say we don't get that granular. We're a very privacy-focused organization. We have a whole team of privacy lawyers, and everything we do has to run through them. So we ensure that anything that we're doing from a granular standpoint is compliant, and all of our privacy policies and everything we do across HCP and consumer are meant to adhere to that. So we try to be very cautious in that regard.
Yep, and I would echo that, the same for Deep Intent. There are product people here. We could
Yeah.
have a little side chat right after this if you want to dig into that topic. But yes, yeah, there is definitely geo and all of that, but we could obviously privacy first.
Right.
Yeah.
Hi, my question would be, are there any endemic publishers who can kind of justify not offering their inventory programmatically? And if so, what are the justifications given, and how long do you think that'll last? Thanks.
What I would say is a lot of endemic publishers sell out their inventory. I mean, that's just a reality of it. On our MedPage site, we sell out a lot of our inventory. That's just a fact. And on the consumer side, we have Everyday Health, but we also have Mayo Clinic and Cleveland Clinic, two of the hospital sites that we run all their inventory. Now, they have massive scale, so they might not run out. But if you're looking from an HCP standpoint, I think that's one of the things that occurs is you're selling it out from a direct standpoint, so you don't even have the opportunity to allow programmatic to flow through.
I think I would say too that it's especially for like the really niche journals, for example, that have such a small audience that they're trying to reach anyway. Like they do legitimately sell out directly most of the time. I think it's just on us from a programmatic side to keep on showing like what the benefits of that are, and over time like trying to see if we can get them to make that available programmatically. But again, like the first time I started doing this pub RFI conversation, we had talked to publishers a little bit smaller than yourselves, but they would not even understand what programmatic was. And they're now at least interested in the conversation. They're trying to explore what would be feasible, whether it makes sense to them from a revenue perspective. So I think it's encouraging, but it could take some time for
I think the money will dictate the transition. At some point, programmatic budgets will exceed those of direct. At some point, agency demands will require endemic publishers to be present in a programmatic ecosystem, and there'll be an inflection point. As I said earlier, right now, I think it is early. And we're learning an awful lot. And a lot of publishers that have invested in setting up a managed service infrastructure are really nervous about how to do it, when to pull the trigger. So, but it will happen. How fast is hard to say, but it's accelerating every day.
I'd just add that I think, as an agency perspective, you're adding a tech and data fee on top of inventory that didn't exist before. So, what collectively as an industry we're going to have to figure out is how does the ease of buying offset the added costs of tech and data?
Deep Intent can eat that cost. I'm not.